Nobody looks too far. We good.
How are you feeling today, Heather?
Feeling much better. Yeah, the
Awesome.
second COVID vaccine was pretty rough on me. So
Oh, yeah.
yeah, that was the day after. So I was like, I can't even get out of bed. So,
Yeah, I completely understand that. I made
yeah.
sure to get home today before my cat got me in the yard because I was yelling at my cat when I had logged on last time. Trying to be better.
Well, I have my dog next to me. He might be joining in the picture for a few, you know. He loves being online.
Let's just give it 1 or 2 more minutes and then we'll keep going.
We are expecting a few more folks from Warren County.
Okay.
Good afternoon.
Hello.
Hi.
Good afternoon, everyone.
Hello.
Hello.
So is Warren almost a quorum? We're almost at quorum, aren't we?
See, Warren County is at 4, I believe. We have Kim, Belinda,
Holly,
and
Christian.
Chris isn't appointed yet officially.
Oh, okay.
We're waiting on Joan and Amy.
It's 3:01. You want to go ahead and we can get started? We'll at least do introductions for those of us who are here so far.
Yeah, I think that would make sense. We go ahead and get moving, and that way we won't waste people's time.
Excellent. I think that sounds like a lovely idea. Let's start with introductions. And what I'll do is I'll call out the name that I'm seeing on the screen as a way of allowing you to unmute and share with us who you are and where you're joining us from. I'm Kimberly Brayton. I'm with Warren County. So I'm going to go ahead and start in the top of my screen. The first one I see is Dean Klickner.
Hi, thank you. My name is Dean Klickner, and I represent the Warren Washington Rose House.
Nice to have you, Dean. Thank you.
Thank you.
Heather, you're next.
Heather Adams Wendell, Washington County.
I see Belinda.
Belinda Bradley, Warren County.
I have Rob next. And Rob, do you want to introduce everyone that's in the room with you?
Sure. So I'm Rob York, Director of Community Services for Warren and Washington Counties. And here in the room with me are a few folks.
Mary Carlson, Office of Community Services.
Mary Murphy, Washington County. Adele Potter, Washington County.
So Adele is one of our new nominees for Washington County, and she's sort of mid-process at this point. The Community Services Boards did approve her nomination. The nomination went to my county committee, and now we're awaiting the full Board of Supervisors to vote on that, which will be the 3rd Friday of April. So another week or so she'll be official. And Kim, I'd like to give her a chance to just tell a little bit about herself. Do you want to go ahead through the introductions first and then come back to that, or do you want to do it now?
Let's go through all the introductions and give her a few minutes so she doesn't feel rushed.
Yep. Same for Lisa Mead, who's joining us. Hi, Lisa.
Okay. The next one I have on there is Trugaria. That's how you show up.
Tia.
Oh, sorry. Tia Ruggiero, Behavioral Health Services North.
Okay, and then next is Lisa.
And my name is Lisa Mead. I'm coming to you from the Granville Junior Senior High School.
Next, Carrie.
I am Carrie Wright, Program Analyst for the Office of Community Services.
Holly.
Holly Irian, Warren County.
Linda.
Hi, I'm Linda Mashad, Washington County.
Tammy Delorme.
Tammy DeLorme, Washington County.
Jason?
I am Jason McLaughlin. I am the new executive director at the White House.
Davia, where'd she go?
Hi, Davia Gaddy with Oasis Regional Office.
Adrian?
Hi,
Go ahead and introduce yourself and who you're with.
oh, sorry, I was making sure my volume was on. You can hear me, right?
Yes.
Okay. Hi, I'm Adrian. I am the program director of crisis services for Northern Rivers.
And then we have Liz.
Hi, everyone. Liz Cole with BHSN.
And Jennifer.
I am Jennifer Eslick, Executive Program Director of Crisis Services for Northern Rivers.
Paige.
Hi, I'm Paige Lorette. I'm the director for the Assertive Community Treatment Program, also with Northern Rivers for Warren, Washington, and Saratoga County.
Okay. Oops, Mary.
I'm Mary McLaughlin with Adirondack Health Institute.
And then Tammy is the one that's running it. And then Dylan, apparently the mic's not working for Dylan. So we're going to have the chat open and that's how we're going to communicate with Dylan. Dylan is already introduced, case manager for Warren County Public Defender's Office. Okay, so if we can take a minute just to go back and meet some of the new board members. It sounds like we have at least two, one in the room, and then Lisa Mead that is joining us through her own Zoom link. So Rob, do you want to go ahead and into the room there and allow Adele to introduce herself?
Sure. Let me turn this around a little bit so folks can see Adele. And I did just ask if
Hi, again, my name is Adele Potter, Washington County. I'm a physical therapist, currently working for Community Work and Independence as an independent contractor. I have worked in the past for Washington County Home Health, and I also have a contract with ARC as needed. Thought it would be a good fit. I'm trying to slowly semi-retire, so I have extra time to contribute.
That's good. I really appreciate your interest. Serve on the board.
It's wonderful to have you. We really appreciate you giving of your time in this way. So thank you.
That's welcome.
Yes.
And then
and we have Lisa Mead also, right?
then we also have Lisa Mead joining us for the first time, also a nominee in Washington County. Lisa is currently serving as the junior senior high school principal in Granville for Granville Central School District. Lisa, do you want to tell a little bit about yourself and your background?
Sure. I've been a teacher or an administrator for a really long time. I think I'm going on my 29th year. So I'm currently in Granville, live in Hudson Falls, previously was in Hudson Falls, and did the bulk of my teaching in Port Edward. So I always end up back in Washington County. Wherever I go, I always end up back. So I'm just delighted to be here and the opportunity to help.
And again, Lisa's name came up. Linda Wright from our office has done quite a bit of work, I guess, with Lisa, and thought of Lisa as a potential board member, suggested her nomination because she knew that Lisa was very passionate about children's mental health issues. So we're welcome to you as well, and we're glad to have you both joining us.
Thank you.
Fabulous. Now, Rob, it looks like I think we've got quorums now, right? I believe.
Let me just double check here. For Warren County, we have Kim, Belinda, Holly,
And Amy's
Chris. Chris is not official yet, I don't think. Who else has joined?
Amy's here now.
Amy is here. That's good.
Yes.
Thank you. Hello, Amy. So we're still at 4. We're expecting Joan,
Okay.
but she's not here yet.
Okay, and it looks like we also have quorums for Washington. So let's wait on until we have quorums for both, and then we'll go ahead and do our votes. So then what I'd like to do is turn it over to Rob to go ahead and do introductions of our special presentations for today.
Sure. So first, I thought we would welcome back the Behavioral Health Services North folks to both Liz and Tia are going to be speaking with us, sharing a little more of an update on how things are going with their becoming operational there with those services. And then also they have a request for some letters of support, which again, I'm inclined to provide. These are further school-based satellite services, so expansion of services into the schools continues to create additional access for the community and for especially for some outlying areas where children and families may be more, have more barriers to accessing services locally. So I'm going to turn it over to Liz and Tia, however you want to proceed.
Wonderful. Thanks, Rob. So I'll give just a kind of an update around our launch and then let Tia kind of go into the schools. So as we are moving into month 5, which is wild because it seems like so much more than that and so little at the same time, we have really set to continue to build out the service lines for our outpatient clinics and the CFR, so for our OASIS and OMH. We are moving through waitlist. I know that was one of the questions that people have had recently. We do have, right now we're averaging around a 2 to 4 week wait list. Volume is high, needs high. What we're seeing is a lot of people have been referred or are coming to us where they weren't identified prior to being Glens Falls Hospital. So we not only transitioned around 2,500 people from the merger, but also now we're moving through the new people who have been identified in that period of time over the last couple months. Also knowing that we're in a pandemic, and I think we can all probably speak to the fact that mental health is just increasing across the board. And we continue to project and anticipate that will continue to rise over the next 6 to 9 months, probably a little nervous about what fall will look like, especially for the school districts, as we're gonna have kids hopefully back to full-time status and having eyes on them for the first time in some districts for a while. So right now we have about 6 clinicians starting with us coming on board. We're hiring pretty quickly, but coming on over the next 4 to 6 weeks to help support the need, and a handful of interns that we're excited about getting set up in the area and work towards building out the workforce for these clinical positions. So just kind of a little bit of an update on where we are. And then I'm going to pass it over to Tia just to share about the 2 districts that we are going to be looking to start in. In the update from the school-based side, we are currently moved into the 5 school districts that we've been speaking about over the last few months, which is Glens Falls, Salem, Greenwich, North Warren, and Warrensburg.
So we've been approached by Johnsburg School District and also Hudson Falls School District to start services in the late summer. For Hudson Falls, it would just be the 3 elementary buildings. And we would like to start working on the application to work in those 2 districts.
So Rob, turning it over to you. I know you have a process and ultimately end up providing the letter from just the opportunity to review with the board. And I'm also happy to answer any questions if anybody has them.
So again, generally, we have, sort of been willing to provide these letters of support, any expansion of services, especially in outlying districts, or in the case of like Hudson Falls, this is an expansion within the district, really. Capital District Psychiatric Center has provided services to that district, but not in their elementary schools. And Capital District does not have any capacity to expand to meet that need. And the district has approached BHSN to see if they could meet that need. So they'll be co-located there with the Capital District services. And again, you know, I would be inclined to support these requests. It probably would be good, at least from Washington County, since they're both in Washington County, if we did take a vote on it.
Do you need a motion?
Yes.
I'd like to make a motion for the Washington County Board to provide a letter of support.
Do I have a second motion to provide support?
Mary Murphy also second.
Oh, okay. Does anyone have any questions or concerns? All in favor, say aye.
Aye.
Okay, motion carried.
Thank you both for your efforts, continued efforts. So Kim, you want me to just go ahead and move into the rest of the other presentation then?
Yes, I think that's appropriate because it looks like we're still not up to quorum for Warren.
Yeah. So let's see. So we have invited Parsons Child and Family Center, Northern Rivers Family Services to join us today, both the representatives from the Adult and Youth Mobile Crisis Team and also the Assertive Community Treatment or ACT team. So we have both Jennifer Eslick and Adrian Slako on from the mobile team, and Paige Lorette is here, director of the ACT team. So I will turn it over to you folks and sort of however you want to give us a bit of an overview of your services, how things have really been going during the COVID period, and you know, any other information or data, anything you would like to share with us. If you have a presentation and want to screen share, Tammy DiLorenzo did tell me that she has it set up so we can you can screen share yourself if needed. At the bottom of the screen there.
Okay, Paige, do you want to go first or do you want us to?
I guess I'll go first. Mine probably is a little bit shorter than yours. So hi, my name's Paige. I'm the director of the ACT team, which is the Assertive Community Treatment Team. We serve Warren, Washington, and Saratoga counties. Just a little overview of the program. It's a Medicaid run program. We serve adults age 18 plus that have serious and persistent mental illness. The purpose of our program is to provide community-based mental health treatment and support to folks that have had multiple hospitalizations, an inability to perform daily functions, and of course, an inability to facilitate outpatient treatment. The good thing about our program is that we do go to our clients, whether it's in the community, in their homes, just a way to make treatment, specifically mental health treatment, a little bit easier for them. We have a myriad of team members that work on my team, including myself, the team leader. We have a psychiatrist who works with us 10 hours a week. We have a psychiatric nurse practitioner who works with us 20 hours a week. We have a registered nurse, a substance use specialist, a family specialist, a vocational specialist, and a program assistant. We're also really excited. I think that we are looking at getting our peer specialist position filled, which is another part-time position on our team that has been open for a little while due to budgetary reasons. So we're really excited to get that one filled again, hopefully soon. And so as far as what we do, we can do a bunch of different things. We are working with clients on either helping find housing or employment. Our team does the prescribing, the psychiatric meds for our recipients. We also can do some med management. If there's recipients that are just struggling with basic med management, remembering to take their meds, or, just not being comfortable having a month's worth of meds on them at any given time, our team can help monitor that a little bit more closely, just to encourage better med compliance. We also can offer substance use support, family support, and of course, linking to other necessary resources. We typically meet with our recipients 6 times a month. COVID has kind of put a little bit of a, I don't want to say a halt by any means, but it's reduced that a little bit, just to kind of reduce exposure. We, at this time, are meeting with people about once a week still. And really, beginning of COVID was a little iffy, but the past couple of months, we still are meeting with people in the community, in their homes, as often as we possibly can. We do have the option to do telehealth services with our recipients, but of course, if we can meet with them safely in the community, socially distanced with a mask, and that's the option that we're always going to choose. We also, since we do deliver meds to some of our recipients, or administer psychiatric injections, we do have to meet face-to-face with a good handful of our clients as well. So really, during COVID, there's been little disruption in the overall treatment of our recipients. We really are trying to keep it as normalized and as consistent as possible as far as meeting with people face-to-face when we can. As far as staffing, I did mention that we hopefully will have a spot for a peer specialist coming up. We have had some staffing changes over the last few months. I think that, as of April 19th, we should be fully staffed again. Unfortunately, we're losing our vocational specialist tomorrow. She's great. But we will have a new person starting on the 19th, so we will be fully staffed again. I would at some point, depending on what COVID looks like and vaccinations and whatnot, I would like to maybe try to do some kind of an open house at some point if it's safe, just so the community, has an opportunity to come to the office and meet us, meet the team, just have that face-to-face with us. We also share our office with Mobile Crisis, so it would be a good opportunity to meet that side of the agency and that team as well. So stay tuned. We'll see how that goes. And then the last thing I just want to mention, for referrals, if anybody is interested in making a referral, they do go through the county SPOA coordinators. Of course, in Warren, Washington County, that's in Secutu. So when a referral is received, we'll review it at the SPOA meetings, which happen twice a month, and then it would be passed on to us. My team would go evaluate, discuss whether a recipient would be a good fit for our program, and also if our program would be a good fit for the recipient. And then we would make a decision from there. Right now we are at full capacity, which is 48. We are looking at quite a few discharges this month. I think we have about 4 or 5 discharges that the majority of them were successfully transitioning out to outpatient treatment because they are doing quite well, which is exciting. So we will have some openings coming up this month as well. I think that's about it.
Okay. Anybody have any questions for Paige about the ACT team? Maybe before we go there, I just comment that some board members may remember when the program first started, it was really front loaded with state aid. So it was primarily funded by state aid, which was gradually reduced over a period of a year or two there. And so really now the program gets still a little bit of state aid or none?
Well,
We're working. Okay, Harry's working.
Rolling the leftover. But I think that this year we should.
Yeah, so the idea, the way the model works is that it is a billable service, and eventually, if they're at full capacity, it should be self-sustaining very near. So I just thought I would make that comment as well. Any other questions maybe for Paige? the program has really been a real asset to the community. They really do serve our, highest need individuals, and they meet them where they're at, out in the community, in their homes. They can meet them, literally anywhere, under a bridge, at a restaurant, wherever. So you really go right to people and meet them literally, meeting people where they're at. So that's terrific.
Thanks, Rob.
Okay. So maybe we'll move over then to the mobile crisis.
So hi all, I am Adrienne, the Program Director of Crisis Services, and Jennifer Eslick is also here with me. She's our Executive Director of Crisis Services. And just to give a little bit of history on crisis services, aside from mobile crisis, there are 2 other crisis stabilization units that are under us, and that's kind of a new change as of last year. We have 2 crisis stabilization units, which are Healy House and North Star. And so we're all under the same umbrella now. But we're here today to share some information about mobile and talk about some of the really exciting things we've been doing in the community with law enforcement. So just a brief history. Back in 2015, we developed the adult team for mobile crisis. And then at the beginning of 2016, we went live with our kids team. And we had an adult team and a kids team in the North Country, and we had an adult team and a kids team in the Capital Region, and everybody worked in silos and had their own phone numbers and their own way of contacting each other. And gatekeepers for up here, it was Glens Falls Hospital managed our calls. And so there was a lot of confusion, and like I said, we all worked very independently of each other. And then in 2018, which is also when Jennifer joined our team, we merged into all one team. So combined all 4 teams into one mobile crisis team and one central number. So there are no longer gatekeepers or additional outside agencies that triage our calls. We have a central crisis line, and all of our clinicians manage that crisis line during our hours of operation. We've had a number of changes throughout the time that we've been involved in the community as well, including expansion of hours. So right now we are in operation from 7 a.m. to 11 p.m. Monday through Friday. And on weekends, we're available 11 a.m. to 7 p.m. We're also available on all holidays. And similar to the ACT team, we are community-based. So we go out into the community and complete the emergency behavioral health evaluations with the goal of keeping people in the community and out of the hospital. Our goal is to avoid the unnecessary emergency room trips or ambulance use or police involvement if those factors don't need to be involved. So we respond anywhere, whether that's somebody's home, street corners, stewards, parks. Up here, we have been out we've been called by park rangers to come out and do an assessment for somebody who's been camping. So really, we see it all. On our team, we have licensed clinicians and permitted clinicians who actually do the evaluations and manage the crisis line. But we also have peer support specialists and family advocates to provide that direct support to clients who are in crisis. Recently, well, not recently, but over the last couple of years, Jennifer and I have really been working to build and collaborate relationships with law enforcement. And up here in Warren and Washington, we've met with Hudson Falls Police Department recently, and we also had a meeting with Warren County Sheriff. We attended their patrol sergeant meeting one morning. So things are finally starting to make some progress up here. It's been difficult getting into the different law enforcement agencies, but we've slowly been able to do that up here. We do have a meeting hopefully coming up with Washington County at some point, and we have some other contacts that we've been able to make, which really has been helpful because of the Criminal Justice Task Force meeting that Carrie hosts that's really how these connections started up here. So I just want to give a shout out to that because that meeting's been really great for us. Some other things just down in the south, kind of what we're doing, because our other office is located in Schenectady. We in Schenectady County have been built into the 911 dispatch. So which is really exciting. And we want to see that across the board. The things that we're doing with law enforcement is really exciting. Jennifer and I have been going into different departments and providing trainings on mental health and mobile crisis and crisis services. Not only, educate them and let them know what the resources are, but also let them know that we support them in what they do. So we're just hoping to continue to build that relationship. Some data I can share with you. I don't have a PowerPoint for you, but I can give you some numbers from really our data. We started it from June 2018, because that's really when we merged all of our programs together and went to our own central crisis line. So from June 2018 to February of this year, we had 4,263 adult calls and 5,944 youth calls. And that's across the all the counties that we serve, which is Warren, Washington, Saratoga, Albany, Schenectady, and Rensselaer. Our numbers have continued to increase, especially over the last couple of months. And we attribute that to just our growing relationships with people in the community and them learning about us and actually calling us. I think that a lot of it has come from our collaboration with the police, because clients are realizing they can call us instead of always calling 911 for a behavioral health crisis if it's not imminent. Some other things, so our diversion rate tends to be around, I would say 80-ish%, give or take. Sometimes it's higher, sometimes it's lower, but on average, let's see. So out of, for that data that I just gave you, for all of those calls, we were able to safety plan with 5,864 people, and we only referred 840 people to the hospital, which is really significant. And I think really speaks to the work that we do in the community. We do have a goal at some point to become 24/7, but we just have to work on some staffing to be able to support that. We have not, one of our concerns right now is that we are not getting applications, but we've heard that across the board, that there has been a lull in applications. I think we're going to start seeing some now that schools are, folks are graduating from graduate school in May. So we should be seeing an uptick in that, hopefully, and be able to hire some people. I don't know if I've missed anything, or Jennifer, if you have anything additional to add, but I'm certainly happy to answer any questions if there are any.
Me, Rob, because it's very painful for me not to speak, but I promise Adrian I have heard all the time. No, I think you covered a lot, Adrian. We did actually meet with both Warren and Washington County Sheriff and Hudson Falls. We're waiting on Cambridge and a few of the other smaller departments. Hudson Falls was very excited, as well as the sheriff, which was really exciting for us because, some of the barriers are response time. Because of how far away some of the calls can be with how rural Warren and Washington County are. But we've come up with different ideas that they can partner with us, even if it's just a matter of handing out our phone number. We have magnets that we have given all the departments to put in their patrol cars, so that every time they're out of a call, they end up driving away to make sure that person knows to call us next. Sometimes putting somebody on the phone with us if it's a matter of us being able to manage over the phone and provide support to the client and also law enforcement. But also, even if the law enforcement are driving away because it's not really a police call, they have been encouraged to call us and refer that family to us so that we can follow back up with them and still send a team out or provide support to them over the phone, so that it's not just police showing up, de-escalating the situation, driving away, and nobody getting connected to health homes or services. So we're doing a lot of hard work. Like I said, Adrian mentioned the trainings, not just about crisis services, the trainings, but we're doing a lot of de-escalation and communication skills and just how to manage EDP calls with law enforcement. So we're really hoping that the different departments up north will, allow us to come in and do some of those trainings. And we're still working out some scheduling, and COVID has obviously, put a barrier to getting everybody in a room. But as Adrian said, we are getting busier and busier. Our numbers have definitely increased over, I'd say definitely the last year in Warren and Washington County, which is exciting because those counties have, always utilized us, but I'm glad to see that we're getting out there more and more into the community.
Park in the driveway?
Glenn.
Put it in the street, huh? Put it in.
Is that somebody asking me a question? Sorry.
Linda needs to mute. Linda Wright. Thank you.
Oh, sorry. Okay, I was recognize the voice. So just, our numbers are continuing to grow. A lot of folks, rely on crisis services. So we're just really excited to be in the community. As humans, we tend to function on crisis. And then when the crisis goes away, we think everything is okay. And so I do think that individuals are going to continue to use us, and our numbers are just going to continue to grow. We did not stop during COVID. We were still out there. We did do a little bit more telephonic than on-site during COVID, the prime times, just to try to keep everybody healthy. But for the most part, if we really felt the call was going to end up at the hospital, or that the police were looking for our support, or we thought police were going to get called to the situation, we responded. We were out in the community just like every other first responder, whether it was fire, EMS, police, because that's what we feel we are. We're first responders for mental health. And so our numbers definitely are a little down for schools, which is, definitely been something that we've continued to work with school districts on, because we're usually in schools all day long, but with the kids not in school, that's been a huge challenge. And we've been very worried because a lot of youth that are ending up in the ER are kids that have already had significant attempts or have hurt themselves, as opposed to the schools intervening and getting us involved before those situations are happening. So really looking forward to kids getting back in school. And but then we think our numbers are going to go really skyrocketing between law enforcement and schools back in session. So we are hopeful to get applications and grow our team because, obviously, social work or anybody that's going to school, their education also got put on hold. So it's also put a decrease in folks that are applying for jobs because they haven't even graduated yet. But we're really excited. If anybody has any questions, please let us know.
Again, another really critical resource for us over the past number of years here, in being able to help people remain in the community when it's appropriate. To be able to safety plan and keep someone in the community and at home, and able to avoid any unnecessary emergency room visits or hospitalizations, and able to facilitate that when it is necessary. I know it's been the team has been a real resource to me. Sometimes I get involved in crisis situations. Families will contact our office looking for mental health emergency police pickup order. And, some of those situations are a little hard to untangle over the phone. But having the mobile team able to go out and a clinician assess the situation right in the community and provide additional feedback on it has been very, very important to me. So I appreciate all of your work. And I know that from your numbers, you are reducing those unnecessary ER visits and hospitalizations. And, that's important because that puts people through something that they don't necessarily need to go through, and able to maintain them in the community. Okay, any other thoughts or questions for any of our presenters? Okay, hearing none, thank you very much for your work. everything you're doing for the community. Kim and Heather, should I just move on into the informational items then?
Yeah, well, yes, go ahead. And we'll do the votes at the end, although I don't know if Warren we're going to have.
Well, we did lose Holly. Just in the event that we would lose anyone else, maybe Washington County wants to, since you have a quorum, to vote on the minutes. We could go back and do that.
We can definitely do that. So for Washington County, can I have approval of the minutes for March 11th? I hope everyone's had a chance to review them. Can I have a motion for approval of the minutes? Trying to. Am I here? Okay, Linda. Can I have a second motion?
Second.
Who was that?
Mary Murphy in the room here.
Oh,
Seconded.
okay. It's hard to hear.
Yep.
Is there any questions or any discussions that anyone would like to have concerning the minutes for March 11th? Are you ready to vote? All in favor, say aye.
Aye.
Any opposed? Any abstentions? Motion carried for approval of minutes for March 11th for Washington County.
Very good, thank you. Okay, under the informational items, I just wanted to share a little bit. Under the 2021-22 New York State budget update, folks may be aware that New York State did pass their budget, so we have an enacted budget this week. And a couple of things that we were, really keeping an eye on in the governor's proposal, and number one was a 5% permanent cut that was proposed to state aid. And happy to say that was rejected, so that did not stand in the enacted budget. And that was worth about $17 million to the service system. Also, there was a proposal to cut the jail-based substance use disorder treatment and transition services. Really, it was a 50% reduction that was proposed, and we receive $60,000 in both Warren and Washington counties for this service. And so we were looking at that being reduced to $30,000 per county. But again, that did not stand in the enacted budget. So both of those items we were quite concerned about, would have been real impacts to our system locally. But happy to say that those are restored in the enacted budget. And in fact, for jail-based services, the legislature added $5 million for medication-assisted treatment. So we have the really statewide, we have $3.75 million for the jail-based treatment and transition services, and now they've added $5 million statewide for the medication-assisted treatment in jails. So I know we'll be continuing to work with our sheriff's departments and our local jails to implement this additional MAP funding. Let's see, also there's approval of crisis stabilization centers. And, I think over the next, well, we're seeing it really, we're right in the middle of sort of a reform of the crisis service system. You see, we've been able to bring up the mobile teams, and with the police reform, we're looking at ways that we can improve crisis response there. Now, the state is talking about developing crisis stabilization centers, and they've provided funding in this year's enacted budget to start to develop these community-based crisis stabilization centers. I know we have the crisis unit at Glens Falls Hospital, but the idea of the crisis stabilization is that it's community-based, There are both professionals and peers that are involved in the staffing of the centers. And the idea is to, again, reduce and prevent the emergency room visits and hospitalizations when it's appropriate, and help people to receive crisis services in the community and return to their home situations. So more to come on that. We don't know exactly how that's going to roll out, if there'll be a certain number of awards per region or something. Maybe it'll be like an RFP type of process where providers have to apply and submit proposals. There was quite a bit of talk about agency consolidation, both the Office of Mental Health and the Office of Addiction Services and Supports. They were actually talking about creating a new agency that was really, for lack of better wording, combining the two agencies. They were trying to use a framework of creating a new agency because they didn't want to try to create the concept that they were meshing two things together that might not fit well. They were going to try to create something new that served the needs of both populations appropriately. However, that was also rejected in the enacted budget. So we will continue to have both the Office of Mental Health and the Office of Addiction Services and Supports as separate state agencies for the time being. Community reinvestment was extended for 3 years. However, there's a 1-year moratorium on it. So in other words, they sort of approved it conceptually, extending it for 3 years, but for the first year, there's a moratorium. So that's a little disappointing. There's also $20 million to support OMH housing rates. And so that's for existing providers to improve the rates. There's $60 million in capital funding and additional rounds of the ESHI funding. The ESHI is one of the funding streams that the Association for Mental Health was able to tap into to develop the Cooper Street housing project that you'll hear more about later this year. Also, we were keeping an eye on the Dwyer Veterans Peer-to-Peer program because that funding was a little uncertain in terms of the executive budget proposal. However, I'm happy to report on that also, that is fully funded for Warren and Washington counties. We receive $185,000 a year for the 2 counties. It's a joint program for the 2 counties. And we work, well, really it's operated by the county veterans offices, and we just really support them and pass the funding through to them. If you hear that there's additional funding for Dwyer, that's true. However, it's not, the additional funding is not for existing counties because it exists in a number of counties across New York State. But the additional funding will allow them to expand to another handful of counties. There was an early retirement incentive that was tossed around and talked about, but that turns out that is only for New York City employees. There's a 1% COLA for OMH Oasis. That is a dollar value of 1.5 million. And this is really the first COLA in a number of years that they have passed through. So when I say COLA, this was, there's some flexibility for how agencies can use that funding. Because there's also a separate minimum wage increase that's specific to targeting the increases in minimum wage. Also, I was glad to see there's $1 million allocated for CIT training. This is the crisis intervention training with law enforcement in working with individuals with mental health crises or addiction crises. let's see, I mentioned there's no new reinvestment this year. I was coming back to the crisis services and sort of the reform of crisis services in general. We also have 988 that'll be coming online in July of 2022. And 988 is really just like 911, although it's specific for mental health and suicide crises situations. So people will be able to call 988, get connected right away to a crisis service. Those lines or hotlines, that phone number will be connected and have to be well networked with our mobile team locally and with probably with local 911 services too, in case there is a need to dispatch to have law enforcement involved. So there'll be a lot of continuing conversations around the interface with law enforcement, I think, and various crisis services. Our statewide association does come out every year with really like an analysis memo of the enacted budget, and that's really not out yet. But once that's out, I will forward that out to the board so that it's really a more comprehensive, document that covers a bit more than what I just covered. Any questions or anything anybody else was hearing about the budget? Okay, if not, we can move on to the 2022 local services planning cycle. Every spring we're involved in a local planning process, and Carrie Wright from our office has been heading that up. Maybe I'll turn it over to Carrie. Usually we have our guidance out by now. We probably would have talked about this maybe in the March meeting. But the guidance was a little bit delayed this year, and in fact just came out, I think, yesterday or day before. So, Carrie, anything you want to say about the local planning process this year?
No, just a brief overview that it looks like not a whole lot has changed. There is a survey to kind of assess how COVID impacted mental health, substance use, and developmental disability services. So I've reached out to our agencies to get some of those questions answered. A lot of it was revamped last year with the help and lots of thanks to Darby for her work on that with me, because I was a little disjointed, I would say, in the last spring. So she was really helpful, but I think we did a nice job, and a lot of it, it's still really relevant, especially around the law enforcement and the crisis services. There was a lot of goals and objectives, which makes a lot of sense. So I think most of it will stay the same, but I may be reaching out to some of you, for feedback on topics and things that you may see, trends that we just don't have a pulse on. So that is about it. Also, it's delayed a month instead of June. It's not due until July this year. So I believe usually we delay it anyway a few weeks because of our CSB timing. So that will be fine this year. We won't need to do that. But yeah, any questions going forward, certainly ask away or let me know.
We'll probably have a presentation scheduled at the June meeting, just to give you an overview of the plan, what it looks like this year in terms of what we're submitting. As Carrie mentioned, much of it's optional this year, but they've put so much work into it and just sort of fine tuning a few things and moving them forward. We'll submit some of the optional documents as well. So we'll be bringing that forward for a vote probably in the June meeting. Okay, also just wanted to highlight again the Police Reform and Reinvention Collaboratives. Several of members of our office have been involved in that, and many of our providers, as you've heard today, have been very actively involved in those discussions, and will continue to be going forward. So just because they submitted their plans, their deadline came, so they've submitted their plans. Most of that, all of ours, as far as I know, in our counties. And but the discussions and the implementation of ideas and plans, will continue going forward. many of the initiatives that were talked about were, we'll explore implementation of this or that. So, putting the plan together was the easy part, and submitting it, ideas. Now we've got to try to implement the initiatives. And then I just wanted to mention the Criminal Justice and Community Services Task Force, also mentioned earlier today, and Carrie Wright has been heading that up. So, Carrie, any update you want to give on the task force?
Just for those of you that aren't involved in that, we continue to meet monthly. We have 4 subcommittees. We have a treatment group, a recovery group, jail and services within the local jails, and education, I believe I was forgetting. Yep. So those continue to meet outside of that monthly meeting, and there's a lot of great work being done, particularly in the education group, to get out anytime we get information about overdoses or any street drugs that may be contaminated. We've been able to get out information a lot faster. They're also focusing on more of the PR, so adding anything to people's Facebook, that kind of thing, just to ensure that we save as many lives as possible. Also, the Narcan training, to continue to encourage agencies and individuals to do that. It can be a 10-minute training. They literally will deliver the Narcan kits to you. You can do it online. So you certainly don't have to work for an agency to do that, but it looks like the Alliance is concerned about another spike, I think, with warmer weather, based on the trends that they've seen. And obviously with COVID, still the isolation. I know things are opening back up, but I mean, with the addiction and the alcohol sales and the heroin, and it's just really a terrible situation that a lot of people are in. And economically, housing, things are not looking great. So we just really want to make sure that we get out as much information and resources as possible. So if anyone wants to be included on that, certainly let me know, and we will add you and your agency so that you can, post any concerns or any information that we put out through that treatment or education group to your agency pages. That would be helpful. So that's about it.
Any questions for Carrie on that? Again, just really like to thank Carrie for her work on this. The Criminal Justice and Community Services Task Force really laid some groundwork and helped to develop some relationships, and early on after our sequential intercept mapping exercises. And so having those relationships already established when police reform came along, that, I mean, it really helped us, to participate in that process when we already had some existing relationships. So thank you for your work on that and for the planning as well. Thank you.
Absolutely.
Let's see. We have some of our other agencies with us, and also Jason McLaughlin is the new director at the White House, and Jason has joined us. So welcome, Jason. Is there anything you want to say about White House or your new appointment there?
Yeah, so it's been an exciting few months for me here at the White House. I took over the new position on January 25th. Margaret DeVries really left me in great shape here, so there was really nothing to come in and fix. We have made some movement. So, when I came in, I noticed a few things about the White House. First, the volume is very high. Even through COVID, we continue to get a lot of calls. So we're taking crisis calls every day. Unfortunately, we had to limit the amount of occupancy that we could have with our residents. But we're looking to expand a little bit. So I've started to do some preliminary work with OCFS to make some room in the house to expand beds and possibly move our executive offices to a different location across the street. So we're working on that. I'll keep everybody posted as we move forward with that. We're kind of just in the preliminary stage right now. But as I see the community growing, I truly feel that the White House has to grow with the community and to provide those needs. So, we're continuing to work with the different agencies that are making referrals to us. With that expansion, I'm also looking to expand one of the respite beds. So I'll talk to you more about that as that comes closer to getting approval for that. So, but things are going fairly well. It's been busy since I started, and I do appreciate everybody's support.
We look forward to continuing to work with you. Jason hopped on a call with Linda and I a couple of weeks ago, and we were happy to talk with him, and we're very encouraged with his vision for the services there and expanding crisis services. So thank you.
Thank you.
All right, let's see who else we have with us. Dean Klickner is the new site director at the Warren Washington Rose House. Welcome, Dean.
Thank you very much.
Anything you want to say about the service? I know you're presenting at our, Dean's also part of a presentation at our Mental Health and Addiction Services and Recovery Subcommittee tomorrow morning.
Sure.
Which you all should have received a notice for. So if anybody wants to join into that, you're welcome. But Dean, anything you want to say?
I just assumed the position on February 15th. Prior to that, I was a peer companion here since July 1st. So I believe in everything we do. I'm looking forward to moving the Rose House forward, just like everybody else. COVID threw a monkey wrench in a lot of our services. So it's been sporadic with, I looked over the numbers over the past, like even a year ago or so, and it seemed like we had a lot more guests. And since then, I believe we shut down in March until I started on July 1st. And once you do that, it seems like it's hard to get your name back out and get people knowing that you're open, that you're available for services. So that's why I'm attending a lot of these groups, let everybody know that we're here. We're looking forward to helping the community the best we can. We've been around a long time, and slowly but surely, I hope to network with everybody and learn how I can the Rose House fit in to all the services that we're providing. So this was a great meeting for me, as I move forward. So I look forward to tomorrow. I'll probably learn a little bit more tomorrow.
All right, great. Thanks so much.
Thank you.
Glad to have you as part of those services.
Thank you very much.
Let's see, Mary McLaughlin's on. Any updates from Mary?
Can you hear me?
Yes.
Can you hear me? Okay, sorry. Yeah, so I think the only update is that the North Country Care Coordination Collaborative is continuing its work, which is focused on using care coordination to improve transitions out of acute hospital stays. That includes mental health as well as medical. And so we're working with the 5 hospitals in the 6-county region, which includes Warren and Washington. And then all the, we have several primary care practices, behavioral health, including the Northwinds IPA, the ACO, and we have some care management organizations and some community-based folks. So we are using some strategies with HCSC to try to have HCSC supply a risk stratification to identify high-risk individuals, so that then we can assure that those individuals have some transitional care management that can help support them in their move into the community. So more to come on that. There's obviously a sort of best practice component, an IT component with HCSC, and sharing some data around the risk and the care manager agency involved. And then there'll be some workforce training. It's a 3-year grant that was awarded to CVPH as the sponsor for the region. So we're excited about what's happening, and more to come on the results. We are measuring results through specific HEDIS and CMS measures.
All right, Mary, thank you. Let's see who else is on for guests. We have Davia Gaddy from Office of Addiction Services and Supports. Always happy to have our state agency partners on. Hi, Davia.
Hi, how are you?
Good. Anything
So
for the
just
group?
as far as updates go, I don't know if you saw, can you hear me?
Yes.
Barely. I know I'm on my cell phone, so it works and sometimes it doesn't. So I apologize ahead of time. We just released some updated guidance today. I don't know if you saw those. I can forward that to you. I'll forward all the things I'm talking about to you as soon as I finish the call. So we have some updated guidance that went out as of today. OASIS is working with the Institute on Trauma and Trauma-Informed Care, ITTC, to provide some follow-up sessions to support frontline workforce. And there's some office hours that will be conducted by ITTIC starting next week. And the first one will be focused on peers, and that'll be April 14th. Again, I'll send you this information too. So then there's one on treatment and prevention staff, and one on program administrators and leadership. So those are office hours that will be available. I'll send you the information on that. And then what else? There are some WebEx. There are some WebEx meetings on presentations specifically designed for people that are, I'm trying to read in the emails at the same time, sorry. Encourage to encourage service recipients and staff who have not been vaccinated. There's some informational sessions that are going on. So I can forward that information to the next one is April 14th. So those are the main communications I see right now. And I'll send those to you. Okay. It's nice to see you all.
Great to see you. Thank you.
You guys are doing some great things there. So keep it up.
Thank you. Thank you, Davia. Thanks for joining in.
I'll probably be on tomorrow morning as well. So.
Oh, great.
Yeah.
Tomorrow morning, our subcommittee is focusing on peer delivered services. So we have both some of our, on the OASIS side, there are peer services, and on the LMH side, there's peer services. So we're having some presentations from the various agencies.
Yeah, so traditionally, Jennifer Haggerty would be the one that would attend for the peer services, but she's on vacation, so I'll be there. So you get to see me twice, sorry.
Yeah, I don't know how we managed to schedule this meeting and that meeting during the school break. It was poor planning probably, but we actually had good attendance here today, so that's good. Also just wanted to highlight, Crystal did send out a flyer on this. Their CWI is having a Brooks barbecue fundraiser coming up on May 14th. And we did try to send that out broadly to our distribution list. So we'll include the flyer again in the minutes, with the minutes when we send them out. Just want to highlight that pre-orders are highly recommended by April 28th. So if you're so inclined, there's that going on. And Kim and Heather, I don't think I had anything else. Oh, the one other thing, Chris Hanchett is also one of our new nominees. Chris, I didn't really give you an opportunity. If you wanted to say anything or tell us anything about yourself, I thought the members maybe were a little more familiar with you. You've joined in to our meetings for a while. But anything you would want to say?
I really don't have anything too specific to say, except for thank you all for the work that you do, and thank you for having me as a part of this group. For those of you who don't know, I worked at DSS for a number of years. Before becoming commissioner, I worked in foster care and adoption. And prior to that, I was a CPS caseworker. So I've been around a while and hope to be around for a while longer. Thank you.
Yeah, thanks for your willingness, Chris, to sit on the board, and thanks for all the experience you're going to bring, with you, that voice for kids services and everything else. So thank you.
You're welcome, Rob.
That's all from.
Okay, well, if there's no other business, then I think we can probably, I think Heather might actually have to call it because we don't have a quorum for Warren, so you might want to call the meeting.
So there's nothing else that anyone would like to discuss. We can adjourn the meeting and we'll see everybody next month.
Thank you.
Bye.
Bye-bye.
Bye. Thank you.
Thank you. Bye-bye.
Hi, thank you.
Hello?